Everybody, it's Dr. Eric Balcavage and Dr. Erica Riggleman. We're back with another edition of Thyroid Answers Podcast, and we have another special guest today. This is Dr. Lacey Chittle. She's a doctor of physical therapy, and she's joining us today for the Thyroid Answers Podcast. We're going to be talking more about hypothyroidism and her kind of take and look at hypothyroidism. Dr. Chittle, welcome to the podcast.
Thank you so much for having me. It's a pleasure to be here.
Great. So we're happy to have you. And maybe what you could do is give us a little bit of your background for our listeners. As a physical therapist, that's kind of not the person that most people are going to for maybe functional medicine. Maybe they might think the same thing about chiropractors, which Dr. Eric and I both are, but obviously you've done some functional medicine training. So give us your background. How did you get from physical therapy to functional medicine?
Right. So before I had this, I was in this world of functional medicine. I worked in pediatric physical therapy, predominantly seeing children with pain disorders and genetic syndromes. Then I fell ill myself. So when I got ill, it was kind of mysterious, didn't know what it was. I was having all these symptoms like loss of vision in my eye. I had inflammation around various organs. So eventually I was just told it's likely an emerging autoimmune disease. I actually developed hypothyroidism, but mine was antibody negative. So it was an induced hypothyroidism from everything else that was going on in my body. I was placed on numerous medications, trying to control my symptoms of nausea and vomiting, fluctuating diarrhea and constipation, joint pain, muscle pain, tendon pain, headaches, and so on. And at the end of a year and a half, my rheumatologist, being on half a dozen medications and going from being completely bedbound to being able to walk to the corner, stand up for 15 minutes, he felt that this was a huge success. And he told me that I should probably consider this my new normal and that I have improved significantly. And I was in my latter 20s, and I thought to myself, I'm not going to be able to make it to my 50s, 60s this way. So I started looking for other answers, and I saw a number of clinicians who swore they were going to be able to fix me, and they weren't able to. So I wound up deciding that I was going to do it for myself. And I found the Institute for Functional Medicine. I went through their training, and I was my first patient. And so,
awesome.
That's awesome. I find it interesting that a lot of practitioners who transition from, an outside field into functional medicine, and often it is a driving force that it was their own health. They were their own first patient and a guinea pig, if you will. But it's that driving force, the emotional attachment to you wanting to get better that drives you to learn, which then opens the doors to be able to help so many other people. I think that's absolutely amazing.
And what and from the children that I was seeing at the time, that had pain, they had headaches, they had functional abdominal pain, and we would just put them on medications, to mask those symptoms. These kids went through surgeries to try and scope that, to see if there's something in their bowel that they missed from the colonoscopy. And what it was we weren't testing for dysbiosis, we weren't testing for, just an imbalance. We're just looking for flagrant disease states. So there's all this time that people are in this gray zone, that they're suffering, and we're not able to help them under the conventional model. So then it just became, it felt like it would be malpractice to practice any other way, regardless of who I saw, if it continued to see just children or adults or anyone else, is that once you have this knowledge, you feel that it would be inappropriate for you not to share it with others.
Yeah, and it's not, and we kind of make this point quite a bit. It's not necessarily that you have a bad doctor or a bad rheumatologist or a bad anything. The reality is it's the model. The model is focused on disease management and disease detection. And what we would probably all agree with is that disease occurs as a result of dysfunction for an extended period of time, right? And so the model is just not set up to look for and manage and identify dysfunction and correct dysfunction, because everything's based on pathology and symptoms suppression. So we have to sometimes be careful that we say, oh, all these doctors are bad. They're not bad. They're doing what they were trained.
They do what they know how to do. Yeah. Right. I mean, I'm sure you have patients who come back to you and say, my doctor won't order this test or do that. And it's that they don't know what to do with the answer, right? So you can't expect a doctor to order a test if they don't know how to interpret it, you know?
Yeah.
Or know what it even means.
Right. And the model's just not set up for that. I mean, we live in a world of an insurance-based model, and the insurance-based model is focused on symptom suppression and disease management or surgery. And if those things aren't justified by running a lab, then the lab's not medically necessary, right? It's not that it's not appropriate. It's just not medically necessary to prescribe or to do a treatment, right? Which is either prescription or surgery. Yeah. So now you're in this world of hypothyroidism and functional medicine, and much like probably us, you realize that hypothyroidism is just a piece of a big puzzle, right? And that's not one of the big points that we make is that, hypothyroidism is really the protective mechanism, right? So when there's stress, there's dysfunction somewhere, the body's natural inclination is to kind of slow down metabolism. And it's not necessarily like the system went haywire. It's really a great adaptive mechanism. And so when you start seeing patients that come to you with these chronic symptomatology, one of those things you probably look to do is identify, do they have a thyroid physiology problem, which is probably the more appropriate way to say it than a thyroid disorder. Because when we think thyroid disorder, it's all about the gland. And the reality is it's about a physiology shift. What are you looking at, or what are you seeing as the big triggers in your patient base of what's triggering their thyroid physiology change?
Great question. So we know with autoimmunity that there are 3 or maybe marginally 4 triggers for autoimmunity. So the first thing you have to have is a genetic predisposition. So usually when you ask the patient, do you have a family history of any autoimmune diseases such as psoriasis, thyroid disease, so on and so forth, usually the answer is yes. Number 2 is that you have to have a leaky intestinal lining. So so that's something that you can identify with a history, and then also with testing of their stool, doing comprehensive stool analysis. And then the third thing that you need is a trigger. So that can be a hormonal shift. That can be like in thyroid disease, it's very common to develop thyroid disease at puberty, during pregnancy, or during menopause. It can be an environmental trigger. It could be an illness. So it could be a bacterial infection, a viral infection, a fungal infection. Those can be things that you were exposed to at some point in your life. Herpes, various strains of herpes are very common triggers for thyroid disease. And then in the environment, it could be anything from your food to something in your water or the air that you breathe that could be the trigger, or a very stressful life event. So figuring out which ones those could be for that individual are really important. So it's an individualized plan that is created based on what I hear in that hour and a half evaluation that I have with the individual. And then in order to have those antibodies produced and stuff, you have to have that loss of tolerance. So that's that feature of autoimmunity, of it actually being diagnosed as an autoimmune disease where you have antibodies and such, is there is a loss of tolerance. So, but for something...
I think that a lot of people will look and try to find that one cause. And I think what you're trying to explain with the autoimmunity process is that it's kind of like the perfect storm. It's that you have the whole set of all of these things that are happening all at once, and they may have been ongoing for many, many years. And then that one trigger, I see it often with a lot of patients with autoimmunity. It was some sort of, a loss of a family member, going through a divorce, going through a big move, something traumatic, usually emotional, that just sets them off. And they often put a lot of emphasis on that one thing, but I have to kind of spin it and let them realize that, no, that's not that was the trigger, but you had an environment that allowed that trigger to become a big issue, because people always have emotional things that happen to them, and not every person develops an autoimmune issue. It's that, we also had a poor diet. You had the environment, you had the leaky gut, you had all of these things that were set up, and then you just had that one trigger. And so I think that's a great way to explain it to people, is that it's a setting of
multidimensional.
Yeah, it is. Absolutely.
Yeah. And even when it comes to like, a gut infection or a chronic viral infection like the herpes. Like I oftentimes get people who come and ask me, well, my viral titers for, herpes simplex, are elevated, so I need to, deal with that. Or, my Epstein-Barr, titers are elevated, and so we need to do something about that. I need to be on therapy, repeatedly or what have you. And the truth of the matter is, well, why can't your body keep that in check, right? Mm-hmm. Many people are exposed to, various herpes viruses throughout their lifetime. It's like over 90% by the time you're in your 40s or something. But not everybody constantly expresses it. Mm-hmm. So there's clearly some dysregulation of your immune system that's allowing it to keep on flaring. So that's what we have to work on, is healing the gut and, strengthening the immune system so it can act appropriately.
Mm-hmm. Yeah, I agree with that point. I think if we start to take a look at what's going on with people, a lot of times we think that, hey, I had virus and I got rid of the virus, or I had Lyme and I got rid of the Lyme, or I had bacteria and I got rid of the bacteria. The reality is that for most cases, you don't technically get rid of the organism. The organism just goes dormant. So you may do some killing of organisms, but for the most part, the organism is either active and creating a problem. It's either functionally dormant, asleep, and waiting for the right trigger to reactivate it, or it's dead. And for most people, it is a stressful event that triggers some tissue damage or cell stress that reactivates the organism. So trying to just kill doesn't really work well, because the organism still has fuel. And that's one of the number one things that we have to address if we're going to help somebody long term, is we have to identify, okay, why do they continually have a fuel source? And that's typically triggered by the chronic stress response that can be, as both of you guys said so well, that could be an acute or a chronic stress, and that's a cellular stress that then triggers the kind of this reactivation of the dormant organisms, if that's at the root of it. It's usually not just the dormant organisms that get reactivated, but the tissue damage elicits essentially fuel. Free iron is one of those great fuels to reactivate organisms, because that's kind of their fuel supply. And now you've got a chronic infection.
Yeah, I think going along with that is the gut bacteria. People always want to go after SIBO and, dysbiosis and candida, but you got to take a look at, well, why is that able to thrive there? Looking at the stomach acid, looking at the biliary function, all of those things are kind of that stepping ground that allow that to become a problem in the body. And, talking about leaky gut being one of those big components to autoimmunity, a big thing about with leaky gut, obviously, is the food sensitivities. So can you talk a little bit how that contributes to the leaky gut?
Yeah, so food sensitivities are, I think, the byproduct of having the dysbiosis for a period of time, right? So it's very common in thyroid disease to have impairment in stomach acid production, right? So you first have to figure out, does that person have low stomach acid? That's then creating an environment where the food's not going to get broken down appropriately in the digestive tract. It's not going to trigger the pancreas to release the enzymes to further break down the food. It's not going to trigger that gallbladder, if you have one, to release the bile to emulsify the fats. And then, so you have this food that's rancidifying as it moves through your digestive tract. A lot of thyroid patients have chronic constipation, so we know that they don't, the migratory motor complexes within the gut are not moving the food along at the right pace. And so that alone, not moving fast enough, it not being broken down well enough, creates an environment where various bacteria and fungi can grow. And that is what then that presence of those things is what destroys the mucosal lining. And then the destruction of the mucosal lining, the infiltration of the tissues with the bacteria or the fungus, taking up residency in your microvilli, create this biofilm and perpetuate the problem. And then so you have food particles, bacteria, viruses, everything, undigested food leaking into your blood supply. That's leaky gut, right? So in terms of the food sensitivities occur well into this whole process. So usually if you look back in the person's history, you'll see all of these hints that this has been going on for a long period of time. You know, the person might have joint pain, and the person might have brain fog, or the person might complain of constipation since they were babies. You know, they don't remember what it was like to ever have a bowel movement every day. So those are the little hints that we know that we have to deal with that. And then those are also the hints that we have to identify what are the biggest triggers for that individual. So that's where then an elimination diet would be appropriate for that person.
Yeah, and I think there's a couple gems there, right? We see that a lot of the people who have chronic hypothyroid symptoms may not realize they have a hypothyroid condition, but maybe one of the early markers of hypothyroidism is a low stomach acid concentration. So they have the stress that you're talking about, right? Some type of cellular stress that activates more of that fight or flight system. And Dr. Erica and I talk about quite often is that really hypothyroidism often starts as a cellular event first, right? And
I believe so, yeah.
And the key tie in there is you need thyroid hormone to make stomach acid. So if you're a person struggling with chronic hypothyroid or chronic reflux symptomatology, right? It's not too much stomach acid, it's too little stomach acid. And that
a faulty sphincter.
Yeah, and that's a key factor in what's maybe a key factor in one of the reasons why you then have that downstream mechanism, because you need that thyroid hormone for stomach acid production, appropriate bile flow, appropriate the migrating motor complex of the GI tract. So I think really, really important point there. So now you have this person coming in to see you, you look at their kind of what's going on, you identify that they have a thyroid physiology problem, and now you're putting them on this anti-inflammatory diet, right? And what's the goal of that anti-inflammatory diet for most of your patients when you put them on? Because obviously when you give them that diet, they're like, you're going to make me do what? There's this fear, right, that I'm not going to be able to do this because this is way too restrictive, right? So what's the initial goal of putting them on this anti-inflammatory diet? What's that anti-inflammatory diet look like? And then give us an idea of how you explain this long-term to them, what they may or may not be able to do from a dietary standpoint going forward once they start to heal.
Right. So I always kind of approach it trying to feel out what they're ready for. I think, so I don't tell everybody like, oh, you have to go on the autoimmune paleo diet. You have to do an 8-item, top allergen, anti-inflammatory diet. I say, what is your diet right now? Let me tell you what the biggest triggers are. Are you ready to just take out those first few, gluten, dairy, refined sugar, corn, soy, like those, ones that we know are probably the biggest triggers for inflammation and for thyroid. Or are you so fed up with feeling terrible that you really are ready to take on, a very more drastic approach to your diet? And so I leave it in their hands so that they can be empowered to make that decision for themselves. And so then we make that decision together, and I give them a timeline, right? So that this isn't going to be hopefully forever, whatever it is, but I expect to see improvements in 2 weeks. I think maybe that's possibly a little bit different than some of the other clinicians out there, is that I do expect them to see that my patients get better within 2 weeks if we have them on the right protocol for supplementing whatever organs are not doing their job, stomach acid, enzymes, etc., intestinal lining support and such, and the diet. So if we got it right, they're going to see improvements in 2 weeks. If I know that that it's not enough for them, like just doing those 3 food items, then I tell them that at 2 weeks we're going to check in and we'll make a decision at that point whether or not we are going to go further into this. So it's become increasingly more popular to do like an autoimmune paleo style diet to decrease the inflammation and allow the body to heal from those food sensitivities. And so I'm definitely seeing more people doing that diet. And so one of the questions I get often about that is whether or not this is a lifelong diet. And the hope is that no, the hope is that you can actually potentially reintroduce for seeds and nuts, hopefully eggs, and that sort of thing. Maybe even down the line, you can tolerate legumes as well. But you need to quiet the inflammation. And so you need to figure out what your particular triggers are and stick with it long enough until your symptoms are resolved or you're really happy with the progress that you've made. So that's a question I get all the time, is whether or not, it's time to reintroduce food. Well, are you happy with your results? Like, are we happy with how far you've come? And if the answer is no, then I tell them, okay, well, let's tailor your program a little bit better to get the results that you want.
I think it's really key importance that you give them options and you let them make the decision, because if you just go in there and say you need to get rid of this, this, and this, and this, they may feel like you're pulling their emotional, their emotional support, their emotional crutch away from them, and they may pull back and not want to do it. And so by letting them make that decision for themselves, I think is really crucial. I'm getting more and more patients who are coming into my office who are already doing the AIP diet, or they've done the Whole30, or, they've already done a restricted program. So they already get it. They've already made that decision that those foods have to come out of my diet. But then they're saying, I don't know if I can maintain this long term. And they're in that confused state of, well, I know I needed to heal my leaky gut, but is it healed? And when do I add foods? And it becomes more of a systematic approach of, okay, let's figure out where you're at in this healing process, and when is it okay or appropriate to add foods back in, and what should you be looking for to get you to a moderation type diet. I mean, I believe that, yes, some patients probably do need to stay on a very restrictive diet, maybe long term, if they start to add foods and they feel terrible. But there's a lot of people that, we want to get them to a point where they can have more variety without that being huge triggers for them, that their body can handle small amounts of, low carbs, things like that, things that are easier on the body that later on they can handle, that maybe now they just isn't a good fit.
And one of the things that I often mention, so I'll mention it here too, that not everyone may think about, is that, we're talking about tissue healing, right? So if you have a leaky intestinal lining, that means that mucosal lining is not there in a very healthy manner, and the microvilli of your intestinal lining are actually damaged to some degree. Well, just think about if you got a surgery or if you got a really deep cut. How long does it take for that to heal? Tissue healing takes 6 to 8 weeks. So how can you expect that to just turn around in a matter of a few weeks of being on, a particular diet? And so then if you have an infection, if you have other issues with the production of making that mucus for that intestinal lining, or migratory motor complexes that are dormant because that connection between the gut and the brain has been disturbed for so long, and so on, then it might take even longer. So yeah, explaining that and empowering the individual to understand what's really going on inside their body and allow them to make the decision, I think is really important, because I feel like, especially having been the patient myself, you feel like everything's happening to you, and you've lost your power. You've lost your life. Your body, your body's, working against you. People are telling you what to do, what medications to take. You can't do all the things that you want to do. And now I'm telling you to do, that you have to do something else, and you can't do these other things that give you joy. It's not a way to go. So it really is important to understand why this is happening and how it functions, and empower the individual to take it on for themselves to heal their own body.
Yeah, I would tell our listeners too, when you started some form of an anti-inflammatory diet, right? One of the key things is to understand is if you're aggressive in the beginning, it's kind of easier. It's harder, but easier, because you're removing so many things. And then once you feel better, then you have that opportunity to try and bring back some of the things individually and see how your body responds to them. And if you do well with them, then there's things you can bring back. The reason we have so much sensitivity sometimes to so many things, just because it's what we're putting into our GI tract frequently, is typically the thing that we wind up having multiple reactivity to. And while you mentioned this, and I say it to my patients too, that, hey, we should start to see, I typically say we're going to start to see some changes in the first couple weeks as you go through this process. And you probably, maybe you can add to this, but sometimes those patients are going to see positive changes, right? Where they feel less gassy, less bloated, less constipation, less brain fog, less fatigue. But it's also important to let people know that there's also another side of that. When you start to give up all these things that your body's accustomed to and used to, you may also have some negative symptomatology to go through that, right? Would you agree with that? And can you expand on that a little bit?
So we might disagree a little bit here. So my business model does allow for people to do this concierge care where they can email and text message me in real time. And so I can catch things when there may be a little hint that something's a little off and we're going to need to tweak something with their supplementation or their herbal protocol for XYZ, infection. And so I can catch it ahead of time. So usually the suffering's pretty minimal. And so because I do that, of course, every once in a while, somebody tells me 2 weeks later, because they're not doing that with me, like, oh my gosh, I was miserable. My brain fog got worse. I was achy all over. I'm like, why didn't you call me? So yes, those things can definitely happen, but there are ways that we can mediate them, depending on what the symptom is. So oftentimes, if we're dealing with an infection, what we're experiencing is some die-off reactions. So, flu-like symptoms, brain fog, achy muscles, joints, etc. And so you can utilize things, supplements to bind that up in the digestive tract, help keep the bowels moving as quickly as possible so things aren't sitting in there for a couple days at a time. So those things do happen, but they can be mitigated pretty well, I think.
Yeah, it's not that they, I try and reinforce to my patients, like if you're a 5 cup of coffee a day person and you're giving up coffee,
that's true. Yeah.
Or even,
I wasn't thinking about that. Yeah.
We oftentimes see people who have regular or looser bowels, and then they give up gluten and grains, and now all of a sudden they're like,
they
now
can't go.
Constipated, right?
Yeah.
And so they're like, I think this diet's making me worse. No. You were having regular bowel movements because you were inflaming your bowel on a regular basis, and it was
dairy's a big one for that too.
Yeah. So I think that's one of the key points I want to make sure that we cover. So if you're a person who's listening to this and say, hey, I'm going to try this anti-inflammatory diet, and you go, man, I feel a little bit worse initially on it, that's not abnormal to just go through some withdrawal responses as you go through the process. And that's why it's always good to have an advisor, a coach, a functional medicine practitioner to work with, so that when you have those symptoms, you're not worse by doing a healthier diet. Your body is just trying to adapt to the changes, because if you take away some of this food, as Dr. Lacey said, you're going to wind up having a change in your gut flora. And that's, you're not feeding some bacteria. There could be some die-off reaction just from that. And there's going to be new bacteria that have to come on board, because you start putting a bunch of healthier foods in there that you don't have the bacteria to really break those down appropriately. There can be some changes. And that's why it's always good, if you're going through this process and you on your own and you start to have some struggle, it's always good to have an advisor to work with to say, nope, that's kind of a common thing. Don't worry about it. There's things that we can do here to help you. And I think that's what you were kind of getting to when you were saying, yeah, we can tweak that a little bit. So
most definitely.
Good point there. So from a stress perspective, right, we're talking about food can definitely play a role on what triggers problems for people, triggers hypothyroid symptoms. We talked about, there's really the big 4: physical, chemical, emotional, microbial. What are some of the other big things that you really see as the triggers for a lot of your patients that say, man, I was doing great, and then all of a sudden I'm now having all these problems?
With regard to the trigger for their autoimmunity, or
trigger for their chronic,
or their chronic symptoms that they're having, like they can't. Okay, so I think that the ones that kind of go undetected. So, as you know, I know you agree with this, is that oftentimes doctors are trying to just correct the physiology. So correct a lab test, right? So we get your T3, T4 looking good. We get your TSH in a good range. So you should be asymptomatic now. and but the person still is having symptoms. So if we've like ruled out that food is something that you're eating is a trigger, we've worked on healing your gut. What other things are most common that are imbalanced in people are things like is cortisol levels. So adrenal problems are very common, along with thyroid dysfunction, as well as imbalances in cholesterol. So you can kind of look at somebody's basic labs and see, how are you doing with these things? What's your fasting glucose? What's your hemoglobin A1C? What's your insulin level look like? Are there some hints there that there's a connection between how your body's handling stress, making cortisol, and blood glucose? Those are tightly tied to one another. And then another common thing that you see on a basic lab test is that a lipid panel is, does the person have elevations in their cholesterol? So is that steroidogenic pathway working properly? So your body starts with cholesterol and will either make cortisol or it'll make all your sex hormones. So then you ask questions about if it's a female, what are your menses like? What's your energy like? Is it symptomatic or not? And so we can kind of tease out these other pieces that are very common dysfunctions in thyroid disease as well, and address those additional issues.
Yeah, I think that's great. And I think when you're looking at the adrenals, obviously they're responding to that stress environment that we're talking about. And often one kind of avenue that I see gets missed a lot in functional medicine is kind of looking at the environment. Everybody's always looking at the food, we're looking at the leaky gut, we're looking at the adrenals, but I think that a big part of our environment, because we think that the things around us can't cause us to be ill, but I think it is a big, big part of chemical stress that we see on the body. What big triggers chemically and environmentally do you see that can cause big issues with your patients?
The air we breathe, the water we drink, all the products that we use in our home and on our skin. Any of those can have endocrine disruptors in them. So resources that I use with my patients are things like looking up your municipal water. If you're drinking tap water, look and see what's in there. There is on the Environmental Working Group has this independent water testing, which is interesting because it will look different than what your municipal water report will be. So sometimes there's things in that water that could be triggers for why your thyroid disease keeps on percolating along and you're having symptoms or can't lose weight or you have a hormonal imbalance and so on. So I say check out your water and see what's in there. Chlorine is in all municipal water, and so the air quality inside the home, what's one of the biggest triggers for toxicity in the air inside the home is the toilet bowl, because you flush the toilet and it aerosolizes all this chlorine into the air. And for some people, chlorine gas is one of those things that can be a trigger for them. So having a filter for your entire home, if you can't do that, at least on your tap, picking a filter that will filter out the things that you have found to be in your water where you live. The other ones are like location. So like, where do you live? Do you live really close to a highway? Do you live really close to fields where they might be spraying with pesticides? Do you live really close to an airport where you're exposed to all of these petrochemicals? All those things can be either endocrine disruptors and or mitochondrial toxins. Excuse me. And so, if you live close to those things and you're just not getting better, it might be worth looking into moving if you can to avoid being so close to those chemicals. Your home environment can also have mold. So a lot of folks, have chronic yeast infections in their nose, in their throats, in their mouths, in their vaginas or digestive tracts and stuff. And part of the reason why they can't get better is because they keep on breathing in some other, fungal infections and stuff. So that's what's keeping their bodies from being able to recover, and it's the immune strength. So I definitely look into those things. I ask everybody who works with me to go to Skin Deep and look up their chemicals that they use, both for cleaning in their home, washing their hair, washing their face, putting on the makeup if they're a woman using makeup, to see what's in it. and if there's any endocrine disruptors in there that could potentially be adding to it, or carcinogens and things of that nature that could be just making their immune system worn down. So
yeah, that's an amazing website. I send all my patients there, and it's eye-opening. You know, instead of me telling you have to go home and throw your makeup away, I tell them, go to the website, type it in. Let's see how toxic it really is. And it rates it, gives it an A through an F rating. And then they can go in there and read all the chemicals and what it can cause. And then they make, again, it goes back to that, they make the decision that it needs to be thrown away and that they need to find something better. And that also, the website gives them an option to search other products that are less toxic that they can find and start using.
Exactly. And, you know, I think it is overwhelming to do food and to do your cleaning products and your makeup and everything else. So, you know, this is something to consider over time, you know, so don't feel like you have to, oh my gosh, I just got my diagnosis of Hashimoto's, I need to do all these things at once. It's like, no, well, when that bottle is empty or you're getting down to the last little bit, throw it out and find a cleaner product, you know. And so over time, you are just shifting your whole home environment. Your toothpaste, you know, fluoride is another one, you know. So for some people, it's keeping their antibody production up, you know. And so little things like that, these are little shifts that when we're just kind of fine tuning your immune system to function as best as possible, that we can look at as potential triggers for you, and whether or not we need to, you know, adjust things a little bit further.
I'd say the one other thing when you're talking about the other stressors, when you say in your home, the other stressor we really have to consider.
People?
Yes. Right? Yes. So I just had this conversation with a patient yesterday. You know, we're walking through what's going on and she's improving, but every conversation is really about the relationship with her spouse, right? And how really unhappy she is. And I said, listen, this is the continual conversation about how unhappy you are in the relationship. And maybe I'm not the person to tell you to get a divorce, but if your relationship is that unhappy, that's probably the number one stressor in your life. That stress is causing your dysregulation in your GI tract. It's creating your cellular stress. It's deactivating your thyroid hormone. It's doing when you're looking externally for all these stressors, and really your major stressor is how you're internalizing your personal relationship with the person that you spend the most time with. And so we also have to consider that, right? You see that as well?
Oh, most definitely. You know, I think as time goes on in that relationship, like you clearly have a very good relationship with this person that you are able to bring that up, you know, but, you know, you might see hints of that, you know, with the eval, but it's totally not the time to say anything about it. But if the person's not progressing and making improvements in their health, you know, then it needs to come up in conversation and say and explain to them how that stress response, you know, the activation of the sympathetic nervous system, the release of these chemicals reduces stomach acid secretion, slows down digestion, how it affects, you know, the pH of your blood, you know, and how that affects then the organs. And going through and explaining that, even giving them, sometimes I'll use the correlation with the stressed cow before it gets slaughtered, right? You know, like if the cow is stressed before it's slaughtered, you know, what happens to its meat? It goes bad. You can't sell the cow. The meat is all acidic. You know, the same thing is happening in your body every time you get stressed out. And if you can't turn off that stress response, you know, that's contributing to your pH, that's contributing to the release of these hormones that are activating the suppression of your immune system and so on. And, you know, of course, there's an effect of stress on whether or not you can recover from this autoimmune disease and put it into remission. But remission is possible.
Yeah, absolutely.
Yeah, we see it all the time. I think that's the big thing when you're struggling with chronic hypothyroid symptoms, those, whether you have autoimmunity that you can see yet or you don't, as Dr. Erica and I talk about all the time, it's usually starts as a cellular event, and that cellular event is triggered by some form of stress. And it can be physical, it can be chemical, it can be emotional, it can be microbial. And ultimately, the best way to get control of your symptomatology and to get your thyroid physiology back on track is to be honest and aware of all those stressors. You're not going to fix them all. They're not going to get them all down to zero. That's not healthy either. The issue is you have to figure out what are the major things that are driving the stress response and start to nip at those and kind of pull them back a little bit. So it could be almost anything, but that's really why it's beneficial to really work with somebody who's objective, looking at your physiology from the outside and saying, hey, look, we've gone through your health history. We've gone through your timeline. We're looking at all these different aspects, your gut, your adrenals, everything else. And what I'm seeing is, hey, your sleep habits are terrible. And that may be your stressor. Your lifestyle is stressful. You're over-exercising and you're exercising inappropriately and not allowing for enough recovery. That's your stressor. You're toxic with stuff that's creating your stressor. And so our job, and one of the reasons it's really beneficial to have a coach in this perspective is it's hard to really be
objective
about yourself because it doesn't feel good, right? And so you think it's your norm. This is how I always am, but that how you always are is why you are where you are. And that's something in that aspect has to change. And I think sometimes coming from we all grew up in the allopathic model that it's always something that's happening to us versus, it's you just got this disease. It's just something that happened to you. That's just the way it is, versus taking a look at ourselves and saying, being honest, okay, what am I doing? What are my habits? What are my daily habits that I'm doing that may be creating my problem? And so
100%. Yeah.
I'm sure you're working through that when you're working with your patients, like, okay, let's look at your health history. Let's look at your timeline. What do you do every day, right? Give me the average, give me what your day involves. What do you eat? What do you drink? What do you do? What do you exercise? Do you not exercise? You're walking them through that whole process, right?
Yeah, that most definitely, one thing I say all the time is stress is stress is stress, whether it's emotional, physical, psychological, it's stress, and the body only responds in one way. I didn't think when I first fell ill myself, I didn't think that there was anything in particular that, triggered it. I was like, oh, I just got a urinary tract infection. I took some antibiotics and that was it. But if, once I learned more and more about functional medicine, I was able to look back on my whole life, of being a type A person who always did too much, when I, from the point that I was a teenager to the point that I, got ill in my latter 20s, I was somebody who was running 50 miles a week. I never took an off season with my sports, lifting heavy, sleeping 5 hours a night. Not only was I doing a doctorate, but I was also working, at 5 a.m. and up until 9 o'clock at night while I was studying. Of course, I didn't think that had any impact on whether or not my immune system would be suppressed. It's like, well, yeah, that chronic stress of not sleeping enough, over exercising, the emotional and psychological stress of being in school and like moving away from my family, I was out in California and I was living in DC, all of those things, it definitely affects whether or not your immune system can be robust and act appropriately to any triggers,
Awesome.
I think that's awesome. Can you, to wrap things up, can you leave our listeners with 3 things that they can do or consider to optimize their health and possibly prevent autoimmunity or get autoimmunity under control?
Oh, wow. There are only 3. Huh?
Just 3.
So I would definitely say that one of the big ones is stress, is to identify stressors in your life. So if you're not sleeping through the night, you need to figure out how to sleep through the night. So if you can't figure it out on your own, get help figuring out why you can't sleep. So that's a big one for thyroid disease. A lot of people have sleep disturbances. Might be blood sugar related, might be related to cortisol production and that sort of thing, but find the reason and address that, address any other stressors. So having a restorative practice every day of something that builds you up. I think when you're ill, it's really hard, to possibly always see the good things in your life. So a journaling practice, a gratitude practice, meditation, time in nature, cuddles with a loved one, something that helps you fill your cup. So managing stress in some sort of way in that regard as well. And then the other, things that I think are really important for overall health is, eating enough vegetables. So people always ask me whether or not, they're ready for the AIP diet or they're ready for an anti-inflammatory diet. Is one thing that usually doesn't hurt anybody is adding more vegetables. The average American eats less than 2 servings a day, and that'll even include things like ketchup. So if you can just add vegetables to your diet, you're probably not going to do any harm there. So from a food standpoint, add some vegetables into your diet. And then the third thing I would say is, if you don't have terrible chronic fatigue, is get some movement in every day. So whether or not that's just getting outside and setting your circadian rhythm by going for a 5-minute walk in the morning, or something that's a little bit more intense from time to time, that some sort of movement I think is good for everyone, as long as you don't have significant fatigue.
Great. Well, we appreciate you coming on, and this was good. It went really fast. So
I know it did. Thank you so much.
Probably need to do this again sometime in the future here and get you back on. Can you give our listeners just an idea of, if they have an interest in meeting with you or learning more about you? Obviously, we'll put your social information in with the podcast information, but how can they get a hold of you, or how could they reach out to you?
Yeah, so it's easy to find me because I'm the only Lacey Chittle in the world. So if you ever just Google me, you'll find me. But it's my website is drlaceychittle.com. And there is on my website and on my Instagram, which is the same, Dr. Lacey Chittle, is a link for you to sign up for a free consultation. So if you want to see if we'd be a good fit, you can always sign up for that yourself through my website or through the link in my Instagram.
Awesome. All right.
Thank you so much.
Thank you. Thanks for coming on. We'll wrap this up, and stay tuned for another episode of the Thyroid Answers coming up soon.
Yeah.